I'm honoured to take part in this discussion today. It will be an underestimation to say that workers have been crying out for science-based policies to end the pandemic for nearly 2 years. In the United Kingdom, we've got a mass murderer as a prime minister who demands, as Dave said, that the bodies pile high in their thousands. Now that is exactly what has happened. More than 160,000 have died. Millions have lost loved ones. It's not just Bolsonaro who should be charged with crimes against humanity. The Labour Party and the trade unions should also be in the dock alongside Johnson. The Labour Party has done nothing to protect people, while trade unions have sabotaged every fight back by workers. The UK has entered a catastrophic third phase of the pandemic. Since the so-called Freedom Day on July the 19th, 2021, there has been 10,871 COVID deaths. In the last 7 days, these are 7 days figures, there has been 331,349 new cases and 934 deaths. As of Thursday, that's 3 days ago, 8,238 people were in hospital with COVID, up almost 14% in 1 week. Every ambulance service across Britain is at the highest black alert level, and hospital beds across England have topped 91% occupancy. Last Wednesday, a press conference, Health Secretary Sajid Javid stated the cases are expected to reach 100,000 a day within weeks, but even the Tories' Plan B will not be implemented. Measures like face masks and workers working from home. Health professionals are reduced to begging for even the paltry safety measures. The situation on London buses has shown what workers have faced during the pandemic. It has been a war on the working class and a war on science. The two go hand in hand. 70 London bus drivers have died of COVID, a rate nearly as high as for frontline nurses. Every one of these deaths is a tragedy, a preventable tragedy. Amika Henecho, a 36-year-old driver from Holloway Garage in North London, who leaves behind a 7-year-old son, told his sister that he was feeling sick but couldn't miss work, he would face a pay cut. Ranjit Chandrapala, a 64-year-old driver on the 92s to Ealing Central Hospital in West London, his daughter Leshy told the BBC that he was worried every day about going to work and that he caught it and died whilst he was on a week-long shift. Nico Enchu, a 52-year-old driver from Battersea Depot in South London, leaves behind his wife and his 2 children. Drivers were actually banned from organising a funeral procession at the garage. They raised money to send Ichu's body back to Romania. The former firefighter was given a state funeral, but in the UK, his life was deemed worthless.
You had a question you wanted to direct to Dr. Jimenez.
I mean, the question is very, very pertinent to the industry I'm in, not just in London, Britain, but it must affect all transport workers globally. And it's directed to Jose Jimenez, who's a professor in aerosol physics, and basically in relationship to the importance of airborne transmission, particularly with the situation in drivers' cabs, with the ventilation, with heating systems, and we were just basically told to keep windows open. In the winter, obviously, you keep your windows closed and you put your air conditioning on, and all the air conditioning in London is just sucking air from outside, and this goes right through the bus into the cab again. So I want to ask how could this be counterposed, and how that would affect drivers' health anyway, and is that could that be counted as a large evidence towards the drivers getting affected from COVID? Because it is a big question. Thank you.
So if I understand, the question is about the importance of airborne transmission and how it may play out in the buses. So
Yes.
But now we know that the large majority of this disease is transmitted by airborne transmission, but it's a different definition of airborne than sometimes people have of something that goes a very long distance and is kind of phantasmagorical. It's airborne in the sense that we breathe it in. Some people exhale it and then we breathe in the virus, and that's how we get infected. And especially into situations when we talk close to someone or when we share a closed space. And a bus is an example of that, right? Now, the devil is on the details. And when you talk about something like a bus, we have studied the number of buses and they vary a lot depending on the manufacturer and the country. Some of them are well ventilated in the sense that they let in a lot of air from outside. And then that air from outside shouldn't have any significant amount of live virus. And then the air from the bus is exhausted. So that will be relatively safe. And something else that tends to make public transportation safe in many places is that people don't talk. And really talking or yelling or singing greatly increases the amount of virus that goes into the air. A rule of thumb is talking is 10 times more than breathing, yelling or singing maybe 50 times more. So if people are quiet and the ventilation is okay, it's not a very dangerous situation, especially for the riders. Now the bus driver is there hours and hours and hours, so even a small risk can compound. Now there are other buses in which the air is more recirculated, and it goes through some filter, but that filter is used there to protect the equipment, to protect the fan from getting really all the dust on it. So it's not really removing much of the virus, and that kind of situation can be more dangerous. So yeah. So anyway, I hope that helps. It's not black or white. It depends on the details.